Now, Executive Suites with WPRI.com reporter Ted Nesi.
Welcome to Executive Suite. I'm Ted Nesi. We're talking today about one of our favorite topics on this show, healthcare, with a CEO who manages a company. You may not know the company name, but you will know their facilities. Les Schindel. He is the CEO of CharterCARE. And I'm going to have you start us right off, Les, by telling me, for people, they might not know CharterCARE, but as I said, they're going to know your facilities. Thanks for being here. What is CharterCARE?
So CharterCARE Health Partners is comprised of Roger Williams Medical Center in Providence, St. Joseph's Our Lady of Fatima Hospital in North Providence, St. Joseph's Health Center, or the former St. Joseph's Hospital in South Providence, 3 community health centers in Johnston, in Pawtucket, and again the one that we have in South Providence, Elmhurst Skilled Nursing and Extended Care Facility in Providence, as well as CharterCARE Home Care and CharterCARE Medical Associates, and then a 400-member physician group called Prospect Provider Group of Rhode Island.
I'm very impressed that you've memorized it. I guess that's your job as
Yes,
the CEO.
yes.
You rattled that off pretty well.
Yes.
I'm impressed. So can you give, there's been so many changes in the hospital marketplace in Rhode Island in recent years. Can you give folks a little bit of the origin story of, because these, the big hospital groups that are part of you were independent for a long time.
Yes.
How did they end up tied up together in CharterCARE?
So back in 2010, 2 competitive hospitals, our St. Joseph's Health System, which was made up of St. Joseph's Hospital, and Roger Williams Medical Center, came together in a merger and formed CharterCARE Health Partners. And that merger for 4 years really consolidated services, mostly in the back office, marketing, human resources, finance, information systems. But what they really needed to look for is an equity partner, because they really needed capital. They needed the access to technology, equipment, facility improvement, as well as having a way to integrate with their medical staff. And so they put together a request for proposal, and they solicited proposals from not-for-profits, for-profit healthcare entities. And after about an 18-month period, they selected Prospect Medical Holdings out of California. Prospect Medical Holdings is a company that's genesis is in physician integration activities. They have for 20 plus years managed physician groups, 9,000 physicians in Southern California, and they manage the population health for 300,000 people in the Southern California community, and that's 300,000 covered lives. And they did this very effectively. And in 2007, when Obamacare was coming into being, they started to say, we need to integrate, and they started acquiring hospitals to make it an integrated delivery system of physician groups and hospitals. So that's what they did, and they bought their first hospitals in 2007 and then continued to grow. And now they're made up of 13 hospitals, and they're growing into New England and into the East Coast. The first 2 were CharterCARE Health Partners. They are also looking at hospitals in Connecticut and New Jersey. And they have letters of intent for a hospital in Connecticut and a letter of intent for a hospital in New Jersey. But why CharterCARE? How did they get? Why did they select Rhode Island? What made this such a special acquisition for them? Because they really thought that their success is on changing delivery systems. This is not a hospital-centric company. This is a company that believes that their success is dependent upon changing the way care is delivered in a market.
And they brought you in just shortly after Prospect took majority ownership of CharterCARE. This was last year. What was your background and that made them decide you were the man to do this?
So I was running 2 hospitals in northern Massachusetts, in Methuen and in Haverhill. Holy Family Hospital in Methuen and Merrimack Valley Hospital in Haverhill for Stewart Healthcare. But what I really had experience in is I have 30 years experience in running different types of hospitals, both for-profits and not-for-profits. My recent position, I was running 2 hospitals, similarly a few miles apart, common medical staffs, and did a lot of work in exactly what Prospect does, managing groups of patients. In the Merrimack Valley area, we had 38,000 lives. So we were managing, implementing population health techniques. And they liked that. They liked an experienced for-profit CEO who also had experience in managing covered lives or population health techniques.
I have a bunch of questions about that and how that's going to work in your vision for CharterCARE. But before that, I want to ask you some more detailed questions on the hospitals that people know so well. Let's start off with Fatima, which is St. Joseph's and Fatima are the same effect. They're the same cluster up there. We know when the CharterCARE deal was done originally in '09, Fatima was losing quite a bit of money, and there were concerns up there. How is the financial health of Fatima Hospital today?
Okay, Fatima has had a financial turnaround. And the reason that financial turnaround has occurred is Prospect has re-engaged with the Fatima medical staff, working very diligently each and every day to work with the medical staff to work together, keep patients within the network of physicians. So the first thing that CharterCARE did when they came here is form the Prospect Provider Group IPA, known as PPGRI. What does that do? Well, it's 389 physicians, and it gets physicians to work together in the delivery of care, maintain referrals between physicians. So at Fatima, it grew the business base. They also focused on the patient experience of care. So with all that, Fatima's had an increase in volume, and they've done a better job of matching their expenses to the volume. So as a result, Fatima has had a turnaround. Now, Fatima's not making a lot of money, but it's not losing any money any longer. And it's progressing. It's growing its services. And that was one of the things that made a difference at Fatima. The second thing is Fatima is responsible and also includes the South Providence Health Center. Now, many years ago, St. Joseph's Hospital in South Providence was even slated to close because it was really losing money. Well, Obamacare, or really the Accountable Care Act, enabled more patients, more of the public, to have health insurance. Specifically, it also expanded the Medicaid rolls. What does that do for the South Providence Health Center? It's grown by 23%.
Wow.
Providing more primary care to the residents in South Providence, to residents that now have Medicaid and insurance. Again, enhancing the overall Fatima financials, but also expanding primary care and meeting the health needs of one of our poorest and that need communities.
So would you, some people I know have wondered if maybe the idea would be after a little bit you might decide, look, we're going to consolidate, we'll just go to Roger Williams and we'll close Fatima, or vice versa. Is that something you would consider?
No. We believe that they have two distinct markets and they provide two different levels of care. So what's the difference between Roger Williams and Our Lady of Fatima Hospital? Our Lady of Fatima Hospital is a Catholic, community-based hospital.
And it's still Catholic,
and
right?
Even though it's Catholic. We still follow the religious and ethical directives of the Catholic Church. We still have a full chapel there. We have priests and we have nuns that are in the organization. But more so, we truly believe in that mission. Monsignor Thoreau is the chairman of the local advisory board. Each hospital has an advisory board. He is the chairman of the St. Joseph's Our Lady of Fatima board. So that's critical. We think the services that are at Fatima in North Providence and the South Providence Clinic are essential to those community health needs. Again, if you go back to what Prospect CharterCARE is now about, it's about health system delivery. And what we care about is meeting the health needs of the communities we serve. Those two communities have distinctly different needs than the Roger Williams Medical Center. The Roger Williams Medical Center is an academic hospital. It's got strong teaching programs affiliated with Boston University Medical School. It's got an internal medicine residency. It's a number of fellowships: hematology, oncology, surgical oncology, rheumatology, dermatology, infectious disease, pulmonary medicine. These are just a few of the programs it has. The most noteworthy being its oncology program, its cancer program. It's got a first-rate cancer center that has the only bone marrow transplant service in the state. It also has the largest, most sophisticated surgical oncology program in the state. That makes Roger Williams distinct and a necessary service. also has a very sophisticated weight loss program focused around bariatric surgery. So when you listen to the two stories, they tell a different story. What you may see is a lot of our services where we focus. There'll be a focus on cancer at Roger Williams, and there may be a focus on other services at Fatima, such as urology, orthopedics, and other services like that.
All right, we're overdue for a commercial break, but clearly you hear it loud and clear. They're both staying open. Stick with us. We're going to talk much more about CharterCARE and its plans for Rhode Island on Executive Suite. Stick with us. Welcome back to Executive Suite. I'm Ted Nisi, and we are talking today with CharterCARE President and CEO Les Schindel. CharterCARE, they have Lady of Fatima Hospital in North Providence, Roger Williams Medical Center. They also have physicians, a whole host of things. If you missed the list, he rattled it off at the top of the show very impressively, so check that out online at WPRI.com. Les, I want to ask you, you were talking about the turnaround at Fatima Hospital, and it's all the more impressive because we know it's not an easy market to keep these hospitals profitable, at least have a positive operating margin. Memorial Hospital in Pawtucket, owned by Care New England, has had issues as well. We see the margins very low in Rhode Island compared to around the country. Why is that? Why do you think Rhode Island's hospitals are operating on such slim margins so often?
I think in Rhode Island we have a disproportionately large Medicaid population as well as a very large elder population. So we are really dependent on government payers for care. And also, these are two different distinct populations. The elderly obviously have a high level of use of institutional services, both hospitals and nursing homes. And so that's high cost. So there's a lot of cost of that. And there's not a lot of profitability in those
because they're Medicare patients almost always, right?
Medicare patients, and they pay probably close to cost. And for traditionally, Medicaid patients were patients that had different other issues, social issues, as well as emotional issues, as well as behavioral issues. And so they too came with under-reimbursed per se, or revenues below the cost of delivery of care. So because we had such a high cost of care, and for these two distinct populations, that made it difficult to have a profit margin. Most hospital profit margins per se, or surpluses, would come from the non-Medicare and Medicaid population.
Commercial insurance.
Commercial insurances of that sort in other states and other markets. So it's much more disproportionate elderly and Medicaid in the state.
Now, Prospect, and you alluded to this earlier, Prospect, which is to remind people, got a lot of company names going here. Prospect, the California company that's now majority owner of CharterCARE in the hospitals, and who brought you in as CEO. One of their big pledges is to invest about upwards of $90 million in, especially in Fatima and Roger Williams, now to take over a big influx of capital. Can you give any sense how soon you expect to start making those big capital investments and what you'll focus on?
Okay, so we've already made about $6.5 million worth of investments, mostly in technology and equipment. That would be equipment for our operating rooms, equipment for our intensive care units, our patient care units, and that could be medical equipment as well as a simple thing as beds and infusion pumps, IV pumps. But that's not really where the big investment will be. We will be announcing very shortly a $20 million investment, and that investment will be in an expansion of the emergency room and department at Roger Williams Medical Center. It's a 12,000 square foot expansion. In addition, a new front entrance that will make it more handicap accessible, as well as a renovation of the main entranceway in some of the patient areas, a renovation of that areas. Also at Our Lady of Fatima, a renovation of its emergency department, as well as its other areas, its patient areas, is going to be some of that investment. We're also going to be adding cardiac catheterization and angioplasty if we get state approval to both campuses. And last but not least, we yesterday put in a certificate of need application to reestablish maternity services at Our Lady of Fatima. Why? Because if we're going to take, we're going to do a special program of a Medicaid at-risk population that we've proposed, we need to really be able to provide cost-effective care, high quality care for a positive patient experience within our hospital campuses.
All right, we're going to take another break. When we come back, we're going to hear more about that very interesting new unique Medicaid program that they're putting together at CharterCARE, as well as some of the other new initiatives going on there. Stick with us on Executive Suite. Welcome back to Executive Suite. I'm Ted Nisi, and we're talking with one of the newest executives in Rhode Island's ever-changing hospital and healthcare market, Les Schindel. He's the CEO and president of CharterCARE, which has Fatima Hospital in North Providence, Roger Williams Medical Center, a host of other places and initiatives they're working on. And a lot of the reason for that growing list of what you're doing is this push on coordinated regional care. You say that all the time, Les, whenever you're talking on panels and things. I know that's important to your vision for how to make this a success. Can you give people a thumbnail sketch? What is your idea of this coordinated regional care? What's different about it?
So what it is Prospect nationally has used this model of it's just exactly what it is. It's managing the care delivery to a population, and it takes out about between 10 and 12% of that population that has chronic diseases. So somebody suffering from chronic diabetes or severe obesity or hypertension, and is using a lot of medical expense, overutilizing the system. So coordinated regional care assigns clinical nurse care managers to that patient, pharmacists to that patient, health coaches, nutritionists, and this team of coordinated individuals work with the primary care physician for that patient and starts coordinating the care that's delivered, keeping the patient out of unnecessary hospitalizations, overuse of the emergency services, emergency department services, overuse of high-end imaging, diagnostic testing, and better use of community services. And this then improves the health of the patient by having better coordinated care between providers, amongst providers, and also these patients also tend to need assistance with medication management and things of that sort. So that's what coordinated regional care is, helping us manage the population health for that population.
Now, does that mean that you want to get these folks to stay kind of inside the CharterCARE network throughout their care? So go to a doctor who's a CharterCARE doctor. If you have to go to the hospital, a CharterCARE hospital. Is that the idea too?
Yes, that's the idea, but also just making sure that they're getting care at the right part of the system. You know, so many people, especially in the Accountable Care Act, and what's happened in Rhode Island has happened in Massachusetts and other states, they overutilize emergency services because they don't have access to primary care, or they get admitted to a hospital because there's not a good coordination of community-based care, or they post-hospitalization get over-admitted if they're an elderly to a skilled nursing facility because there really isn't that coordination of home-based services and care. That's what coordinated regional care does. It takes that at-risk population, not the entire population, and make sure that their care is accessible to them.
Now, you've mentioned a number of times Obamacare, the Affordable Care Act, whatever you want to call it, and Governor Raimondo, as the Medicaid population has grown, is pushing to hold down costs in that program. There's been a ton about that this year. And one piece of it that's interesting, CharterCARE has this proposal to take about 25,000 people and manage their Medicaid care differently, hopefully to help the state save money. What's the idea there?
So we took our experience, Prospect's experience, in California. They have 85,000 Medicaid lives at risk. And they went to the various insurers in California, Health Net California and CalOptima, two managed care organizations, and they took risk. They said to them, we want to manage the delivery of care for this number of lives. So in this state, we went to the state, Governor Raimondo, Speaker Mattiello, Senator Pavaweed, so the Senate President, Speaker of the House, and the Governor. And we said we could take 25,000 lives and do a better job managing the care delivery for that population. And what we would do is what I described, coordinated regional care for that population. And we've proposed that, and it would save, fully implemented, $6 million a year to the state. It works very simply. We would get 95 cents of the Medicaid dollars coming into the state. 5% would be left with the state as savings, guaranteed savings. Working with the managed care organizations, that's both Neighborhood Health Plan and United, we would be literally a subcontractor managing the care and the care delivery. Who would provide that? PPGRI, Prospect Provider Group of Rhode Island, that 387-member physician group made up of 120 primary care physicians would be the core delivery network for those patients. And they would manage the care for those patients. Now, when we looked at the data, about 12 to 15% of the patients incur 67 to 68%.
Yeah, those
of the
numbers
cost.
are always wild.
And it's unbelievable, but that's where we can make a difference. We have the systems, we have the approach that have shown to save this kind of money. So we've made that proposal. It is now sitting, it did make it to the budget that is now being evaluated by the General Assembly, and we're hoping it will be implemented. And for that reason, we submitted these new certificate of needs for a maternity service at Our Lady of Fatima, reestablishing a faith-based maternity service. We also submit a certificate of need for cardiac catheterization and angioplasty, because we believe to have that capability will save money, to reduce unnecessary transfers to trauma centers for a level of care that's been proven clinically to be able to be done at a community hospital setting. Like today, there are 2 in this state, at Kent Hospital and at Landmark. We believe that in our market, we should have that capability because of this program. So with that, that's part of our $20 million investment. And what is that really going to be? Jobs. So when people talk about job creation, Prospect's doing that. We have had no layoffs. We have tried to build our workforce. We have 3,000 employees in our workforce. We think our capital investment will create jobs and also build a better healthcare system. So
I can only give you about 30 seconds on this one because we're running short on time, but the governor, as you know, a different part of the budget says we're going to cut rates on Medicaid again, 2%, though you might be able to get some of the money back later on quality incentives. This is for all the hospitals. How are you feeling about that?
I feel okay about that. I was part of that discussion. I worked closely with Mike Souza from the Hospital Association of Rhode Island. We testified in front of the House Finance Committee on this topic in support of that proposal. We think that is the way to go. You need to reduce some of the quality metrics, is reducing readmission rates into hospitals, reducing the use of hospital emergency services, improving the other quality metrics such as infection rates in hospitals. Those are the things that we think we should be doing, and we're all for it. If we perform, then we can then get rewarded back. That would be fine. Well, music to the governor's ears, no doubt, from Les Schindel. Les, thank you very much for being with me. He's the president and CEO of CharterCARE. You can learn much more about them on their website. If you missed any of this episode of Executive Suite or any other episode, you can always catch all of those on our website, WPRI.com. If you're interested in this topic, we've done a bunch of healthcare interviews the last few months, so I hope you'll check those out. Be sure to be back with us next week when we tape a new episode, and we'll bring you the latest on business in Rhode Island and Southern New England. And thanks for joining us. Thank you.